Tribal Vice Chairman? Tribal Secretary?
Yes.
Mr. Chairman, motion.
Thank you, leadership. Moving on to our Tuesday, February 8th minutes.
Motion to approve, Mr. Chairman.
So moved by Kakiza Haska, second by Haiba. Question by Buffalo Lake.
Curtis Bissonette?
Yes.
Brandon Gypsy Wana?
Yes.
Floyd Kirk Jr.? Dallas Owen?
Yes.
A. Lydia Amos? Louis Johnson? Dion Crawford? Tribal Vice Chairman? Tribal Secretary?
Yes.
Mr. Chairman, motion passed.
Thank you, leadership. Moving on to our for-profit meeting for Thursday, February 24th minutes.
Motion to approve, Mr. Chairman.
Motion made by Kakiza Haska to approve the February 24th minutes. Second by Louis Johnson of Buffalo Lake. Question by Iagata.
Yes.
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 Dallas Owen? A. Lydia Amos? Louis Johnson? Dion Crawford? Tribal Vice Chairman? Tribal Secretary?
Yes.
Mr. Chairman, motion passed.
Thank you, members of the council and execs. Moving on to our resolution on Executive Resolution 2201. This is authorizing the submission of grant application to the United States Economic Development Administration in response to the FY 2021 American Rescue Plan Act Indigenous Communities Notice of Funding Opportunity.
Motion to approve the grant or the resolution 22-01, Mr. Chairman.
Thank you, Kakiza Haska. Motion is on the floor.
Second.
Second by Dion Crawford. Question by Dallas Owen.
Yes.
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 Dion Crawford,
Yes.
Tribal Vice Chairman, Tribal Secretary.
Yes.
Mr. Chairman, motion passed.
Thank you, council and execs. Moving on to our executive resolution number 22-002. And this is authorizing the submission of application to the Centers for Disease Control and Prevention. Travel Practices for Wellness in Indian Country Cooperative Agreement.
Make a motion to approve.
So moved by Haipa. Second by Iagata. Question by Kakiza Haska.
Yes.
Floyd Kirk Jr.,
Yes.
Dallas Owen, A. Lydia Amos, Louis Johnson, Dion Crawford,
Yes.
Curtis Bissonnette,
Yes.
Tribal Vice Chairman, Tribal Secretary.
Yes.
Mr. Chairman, motion passed.
Thank you, leadership. Thank you, council and executives. Moving on to our executive reports. Members of the council, you have my folder with you guys. Help Medaki Happy Hope on our relatives. These are the highlights for the month. Again, kudos to our roads department along with facilities and building personnel who continue to work hard in clearing snow-covered parking lots, access roads, and various roadways. Thank you for your continued hard work and your dedication. I know there's a time we get calls in the night and that Councilman Johnson, he needed some help. It was an alleyway back there in the trees that is always deep snow. So travel roads at the time, they were shut down along with Roberts County, but I called on Breon Lake with using our equipment, went out and helped that elder. And so she got the furnace on and she was okay that evening, what she needed. So I just needed to go back and help her. And there's other people that we help too, besides that individual, when times are needed, when we have storms like that. So the roads are out, they're helping. Members of council and leadership, we implemented a drug task force to address the drug overdoses and eliminate illegal drugs on our reservation. We have held a couple meetings right away to date, and we are quickly relying on our resources. And at this time, I wanted to present a little council support and also executive support, a little budget, because we wanted to plan on going on traveling to go visit the programs in, was it White Earth? In White Earth. And there's a small group of us that were meeting also too. So I was going to present that in my report, but that's going to go into Sunny because we're still putting the numbers together for that. So just a heads up on that. And if, Deanne, if you have anything to add on that one, the floor is yours.
Thank you, Mr. Chairman. I don't want to go into too much detail, but I do want to say that I'm grateful for your leadership in bringing this group together and collaborating those resources. I'm also really grateful for Curtis and Susie and for stepping up and being a part of the group. Right now we're working on probably the first layer, and that would be doing some live videos and things like that for community education, as well as planning meetings with some of the law enforcement and court services, court personnel, both federal and state. I think that we're going down a really good road, and we've really committed to taking up the time of the employees for only an hour, but that's been very effective because we're very focused and have very quickly prepared tasks and assigned those tasks. So I just want to say thank you. I think that, we're getting a lot of good insight and a lot of good information, from our employees, our boots on the ground employees that are working in the field, as well as meeting with law enforcement, which I think was really effective. So thank you again, Mr. Chairman.
And just add that to, regarding task force, remember we wanted me to draft out some letters and send the invites out to. Those letters already went out, so. For the task force, we wanted other members to be at the task force in the next meeting. Go ahead, Kakiza Haska, if you want to add to that.
Yeah, I think we're really getting somewhere on that. Number one is because we're having weekly meetings. And two, people that are on this committee are really engaged and really committed to helping our community in any way they can. And so I just want to commend everybody that stepped up and wanted to be a part of this, because it is a good thing. We're looking at, community-wide here, within our reservation on ways we can combat these drugs that are coming into our community and stuff. And so the meetings we've had were very, very informative, and also very helpful because of law enforcement being a part of that. And so I just want to commend everybody for that, taking their time out of their day once a week to sit down and brainstorm ideas of what we can do moving forward with that task force. And it's very much needed also. And so I just want to say that much. Thank you, Mr. Chairman.
And also, too, I want to commend the leadership, too, for stepping up, too, being part of the task force and showing that you care for our community. So I appreciate that. And also, too, Madam Secretary, I know some of the your programs that are part of the task force, and I thank you for allowing your managers to be a part of this to help the community in their ways. So I appreciate that. Anything else on the task force before going? Yeah, got the floor is yours.
I would like to encourage our community members throughout the reservation to play an active part in combating the drugs. I welcome the support of the community, and you play an important role in combating the problems of these overdoses, the lives that are lost, these young people, to keep them in mind. And I say prayers for our community, because it takes all of our oyate to combat this problem. And I want to thank the chairman and Dion and Curtis, as well as the tribal police chief, and also the sheriff, and those who are participating in this important effort to handle the situation that is taking our young people. Thank you.
Members of council and executives, I was a guest speaker for the Free Leonard Peltier event that was on the steps of the federal building in Fargo, North Dakota. Myself and Kakiza Haska Representative Curtis Bissonette were attending along with the Spirit Lake Nation Tribal Chairman Doug Yankton and his council representatives. We were asked by some leadership that we got called and invited to share our words over there. So I sent my speech to the Shota paper. So I think our Yapahal back there got a copy too, I think. So we held our Treaty Day recognition by inviting relatives of two young boys, two young leaders who perished at the Carlisle boarding school. Our Veteran Service Office sent representatives from the Kit Fox Society to carry in the flags with our Eagle staff. And Delbert Bernard's family provided the appropriate songs. This is the next step in a long process of returning the remains of Amos Laframboise, son of Joseph Laframboise, and Edward Upright, son of Wanata. FIPA will be instrumental in working with the Department of the Army for getting these two young men home. And also, too, just remind leadership that we're part of this, too. We just had the signing ceremony, too. It was at Paulina Little from the Spirit Lake Oyate that she made her journey here to be part of that. We provided a meal. So that was another instrumental event. Peace back home. So there'll be continued meetings in the future here, and so you could be a part of that. So the government will be providing only rides to 2 family members to go after those young chiefs, and it's going to be up to leadership and myself that will figure out something if we wanted to send other tribal members to go support that event. So that'll be down the road here. Any questions on that? I know leadership's been part of that event too at the Magic, and also to the signing ceremony here. If not, I'm going to go on. We also had a day of prayer to recognize our relatives that lost to the COVID virus and other situations such as accidents, suicides, overdoses, etc. We are planning to do this regularly to give people the opportunity to come together to meditate and offer prayers in their own way. So giving leadership the heads up, we'll be doing this, I think, when it warms up, so we could do it 4 days, like in the past. I think, Madam Secretary, I think I wasn't on the office back then, but as you guys remember, I think it was 4 days in the same area in front of the Elderly Nutrition Building. And also, too, going on in the summer. And just a heads up, too, we'll continue to use our community Chinupa to bring that out and support our community with prayer. Mandatory vaccine update for employees who receive hazard pay per council motion. Just a couple days ago, I know I came back and Don let me know that Dallas was asking for that, and I forgot motion that was Dallas. But I have the interim director here to help me with that discussion too. So if you can step up to the mic and kind of give an update on that. I appreciate your time.
We met yesterday, the COVID task force, and draft for the, I don't know if you reviewed it, but Mr. Gunn hasn't emailed us the draft of the update as of today, but it is in a work in progress. I found out on Thursday afternoon about the motion, so I apologize. I was not aware of Dallas's
And I think I was notified the day after, I think. So, any questions, Dallas, for that? I think you were asking the questions.
No, as long as it's been going and it's in flow, I'm happy with that. Thank you.
Deanna, floor is yours.
Thank you, Mr. Chairman. And we had a discussion with Dallas, letting him know that he needed to follow up on these as well, doing the work orders for legal when he brings those things, because I think the rest of us take that responsibility on ourselves, and so he understands that now. Thank you, Michelle. The one question I did have is that when I read the policy, it was very specific, but I know that the CDC guidelines change quite often. Is that being addressed?
Yeah, we discussed that as well. We had CHE involved, tribal health, everybody that's involved on the task force brought all those issues up. So we did work with Mr. Gunn on the draft, and he's supposed to be sending that out, I believe, today. Correct me if I'm wrong, Sonny. Right, on the
Sonny, can you go up to the mic? We have a listening audience out there. Sorry about that.
So we had a working group. We meet every Monday and Fridays. So they came in on Monday, and Mr. Gunn was part of the meeting. We had our health team and EMS and whatnot. So Sarah and Audrey and whatnot on that, implementing it. It was a working group. It was about an hour and a half that we went through it, and we changed all the policies and procedures on how it was fit for our policy, and it goes back to our HR. So that is drafted. I do have it. I could get it printed and I could bring it in. But everyone was involved. It was really nice to see everyone have input and have it implemented, and we did get the language pretty straightened out in it. So it is actually complete, and it was done yesterday. So I will bring that in and for you guys to review, and then, yeah, I think that's all I have.
Thank you, Sonny. Go ahead, Dion.
Thank you, Sharon. Just one quick question. What kind of timeline are we giving to employees to be vaccinated before we pull their premium pay?
Okay, so that was the biggest question. What is fully vaccinated? Fully vaccinated is probably the double doses and also the booster. But you have to allow that it's 30 days to get the first 2 shots and 6 months to get the booster. So you have to make sure that's spelled out in there, and you have to allow that time, but you also have to make sure that you hold the employee accountable to within 30 to 60 days to get the 2 shots, and after that to make sure that they're up to date on the booster. So fully vaccinated is the 2 shots plus the booster. And if it's been 6 months after you got your booster, then you could probably get another one. You would just be outdated. You just have to keep up with. So it was really, the discussion on how to, the timeline, and then if you got an infusion, you got COVID, there was a lot of scenarios that played out. So we tried to, so all the scenarios came in the language, and how we were trying to sort it out was really, and I think it came out pretty well. So fully vaccinated is what we determined was the 2 shots plus the booster. So that's about a 7-month time frame, to be fully vaccinated. But to get the 2 shots within the 30 to 60 days. That's realistically, that's how it's written out with the CDC, so.
Also, what's the cutoff date? Is council gonna say a cutoff date that as of this date, no more hazard premium frontline pay until they're fully vaccinated? That was a big question too, and then when does it start? Because I know we did discuss that, the vaccination that we require would be held in the benefits files in HR, not in their personnel file, because if we're ever audited and an employee personnel file is requested, they have access to everything in there. So we'll keep that all separate. But we didn't know if there was a cutoff date that as of May 1st, no more pay until you start the process. That we had a lot of questions as well.
Dion, if you don't mind,
Yep,
I know you had the floor, but if Madam Secretary wanted to add to that discussion, she had wanted to add something real quick.
Yeah. Thank you. Okay, so fully vaccinated includes the booster? Is that written down somewhere? Because I don't really agree with that.
Well, that was a conversation that we had, and I guess that's a conversation or a question that we have for you as well. What is fully vaccinated?
2 shots. 2 shots.
The 2 shots without the booster.
Without the booster, because I think that booster is optional. In my opinion.
And that's in a lot of opinions, we're at that table, so a lot of opinions were in that discussion. So, we really do need to make a determination on that.
Is the definition in the CDC guidelines of being fully vaccinated including the booster?
I don't think it includes.
I don't think it is.
I don't think it includes a booster.
But
Okay.
I think IHS is including the booster.
But
So we're conflicted.
yeah, in a conversation, I also said we were sovereign. So
Yes,
so,
exactly.
we
are.
so don't
We are
so
sovereign.
that was implemented as well.
Yeah, we are a sovereign, and I think that decision is ours to make. And, okay, that's my point. And also, are there religious or are there exemptions?
Yes, there's an application for religious exemption and also for medical exemption.
Yeah.
IHS has it, and I think it would be on the form of the application that you would have, and that's a discussion we had as well too.
Okay, I just wanted to make those 2 points. Thank you.
Going back to Dion, floor is still yours, and after that, Dallas.
Thank you. Just real quick, maybe what we should do instead of bringing that and trying to pass that, today or tomorrow, because these are your guys' employees, and maybe we need to give you guys some time to discuss with the work group and make those decisions about, some of those items. Thank you.
Dallas, floor is yours.
So I do believe written in the motion, it said that fully vaccinated by an FDA-approved method. And the booster itself, if I recall, it's highly recommended by the FDA and it is acceptable. But that's just kind of like what I touched on there. So when I made the motion, the intent was just the 2 shots. So that's just me putting that out there. The booster I thought was highly recommended. And I still recommend getting the booster to all listening audiences. But that was just my intention when the motion was made by an FDA-approved method. And so I just wanted to make that part clear. And I thank Madam Secretary for bringing up the religious and medical exemptions, because that's also important in this matter. And then, honestly, when we're thinking a timeline, the sooner that you can mention people that this will be kicking out of effect, the sooner that you guys, in my opinion, that the 7 months can kick in. Because yeah, Sonny's right. There is a timeline. You can't just get all shots, boom, boom, boom. You have to wait X amount of time. And so there are scenarios that are going to come into play, but that's kind of where the policy would come into place. And that's kind of why I left it vague initially, was because I knew that more work was going to be done come this policy. But then initially, the part that stuck out the most, that most people questioned, was this legally viable? And that's where I wanted it to be legally reviewed by Steve Gunn. It sounds like that went okay. And so now the next part is policy. And so when I'm thinking timeline, my personal preference here is probably at the very I'm hoping to see things as long as I think someone putting in their work and moving forward with this in a good way. But that's just kind of where I'm at. If I'm thinking, the first shot, second shot, and then if they happen to get COVID, then you put that one in there. So, like I said, that just was my intent when I made the motion originally. Thank you.
I appreciate Ms. Deitch for coming in, and also Sonny. Thank you for your time.
We'll get you the report from Mr. Gunn just for you to review, and then just for your information. I'll email it, and then I'll bring a hand one in. Thank you.
I just want to give leadership the heads up too regarding our federal building over with Brian. I know he's always bringing me some bad news. The building is in bad shape, so I know pretty soon we need to make a decision that we need to move out of that building. Go ahead, Curtis.
I think there's still time there because I think that that 5-year lease expired and they ended up just doing another 5 years. So there's time there to make a decision. It doesn't need to be. It's not of importance right now. I think what he's talking about is us guys putting more money in her, but I don't think that's the case at this point. So there is time. We still got programs in her that we need to make sure that their buildings are done. And we got the veteran service in there still. So we have a extended 5-year lease on that. So we need to just make sure we're doing our follow-up with them, getting into their new buildings too. So thank you, Mr. Chairman.
And just a heads up, when you bring or take my report back to you guys' district meetings, law enforcement provided their adult arrest report, kind of breakdown of the juveniles, traffic stops. So that's included in Captain Gaikowski's report for you guys when you turn it into your guys' district centers. That wraps up my report. I need approval for my report. I'm going to go into our executive committee minutes and a discussion on Cahill. Cahill is bringing in, because there's a shortage of burial containers, they're asking an increase from the tribe. So I need to bring that up in front of leadership on behalf of the executive committee.
Motion to approve Chairman's report.
So moved by Oladensi, seconded by Tokunawa. Question by Kakiza Haska.
Yes.
Dallas Owen. A. Lydia Amos. Louis Johnson. Dion Crawford.
Yes.
Curtis Bissonette. Brandon Gypsy Wana.
Yes.
Tribal Vice Chairman. Tribal Secretary.
Yes.
Mr. Chairman, motion passes.
Members of the council, going on to our executive committee minutes for Thursday, February 17th. You guys already passed the resolutions that we set forth for you guys. But going on to the Cahill discussion, Madam Secretary, if you wanted to help me out with this discussion as it came before you, and we decided to bring it in front of leadership for discussion.
Kay Cahill approached us to increase the benefit amount to help with the burial of tribal members because the cost of the containers that the casket goes in has increased. So she's only asking for an additional $600 per tribal member. So right now it's $3,600 that the tribe helps with, and it would go up to $4,200. I think I have written on it.
Yes.
And the average cost of a burial is, depending on what you choose as a casket and whatever, it can run up to $10,000 easily for the families. So this would help the families. So the basic funeral assistance is $3,600. The oversized caskets are $600 extra, and out-of-state deaths is $300. So that's the three categories. So the proposed cost would be the basic funeral assistance would increase to $4,200. The oversized casket would stay the same, and the out-of-state death would stay the same. So it's a increase of $600, the outer burial containers.
Kakiza Haska, floor is yours.
So, does the tribe pay for this or does the BIA? Is this the BIA's issue?
This is the tribe's, so when a family member passes away, they go to the Bureau first. And if the Bureau denies payment, then they come to the tribe.
So, I guess I don't understand why the Bureau would deny something like that when they're supposed to be.
It's based on whether you have an income or not. So if you do not have an income, maybe you have a limited income or a fixed income, then you would get approved through the Bureau. But if you're denied payment through the Bureau, then it's pushed over to the tribe. They walk it over. And then we pick it up, no matter what, because you're a tribal member.
Okay. So my other question then is, do we need to increase that budget at the tribe level?
Yes, we do, because with the rate of death that we have right now, I think we just use it till it runs out, and then we may have to increase it.
So I guess my question is for the vice chair then, can we look at that portion of it for tomorrow? I'd just like to see it. I've never seen it, so I'd like to see that.
And also too, going off with Kakiza Haska before I turn the floor over to Haiba. What kind of heard it, the executive budget actually was that motion that was made that the money came out of our budget to pay for all the districts for salary.
Yes, which still burns me up, because it's $1,500 that comes out of our executive budget that goes to all 7 districts, which isn't really fair because, for one thing, why is it coming out of our executive budget when the districts all get a distribution from the magic or the gaming distribution, and they all get money out of their own budget when they send it, when the districts get their distributions, the elderly get their portion out of that budget. Yet we're turning around and giving all the districts $1,500, which is basically almost half of our budget, our executive budget, because you take that times every month, 12 months, 1,500 times 7 for 12 months. That's how much that we give the district elderly programs. And initially, like the chairman of DCA said, the Enemy Swim District got the 1,500 for their elderly food feeding program up there. And rather than take that from them, they turned around and gave all the other districts 1,500, which don't have feeding programs. So, and Enemy Swim doesn't have a feeding program anymore either that I know of. So I really think that we need to consider taking that 1,500 and doing away with it out of our executive budget, because it's gaming, and they all get gaming already in their districts from the distribution. But that's my feeling on that, and because I see how it hurts us. It hurt our funeral assistance last year. It basically wiped out our, what do you call that when you, sponsorship, and it wiped out our general welfare when they took that money. So, and that's my thoughts on that. Thank you.
Thank you for adding that, but that's what I wanted to point out too. With that, it hurted our executive budget, so we couldn't help with most of the sponsorships and all that stuff that came through our office because of that. Kakiza Haska, the floor is still yours. If not, I'm going to turn it over to Haipa, then Dallas. Haipa had her hand up right after you. Haipa, the floor is yours, then Dallas.
Okay, so, whose budget is it coming out of already when you pay, Cahill's? Is that,
The executive budget.
has it always been under the executive budget?
Yes.
Then the next question was, at this rate, if we're gonna do this, then that additional 600 per person is still gonna come out of the executive budget. I had another question, but I forgot it. I'll think about it. That's all for now. Thank you.
Thank you, Haipa. Going over to Tokunuma, floor is yours.
So obviously COVID is an impact on, how many people we have at the district center, but I did check into it. We do provide meals still. It's just on a smaller scale, but there are meals still being provided at the district. So just wanted to add that. I can't speak for anyone else though.
Thank you, Dallas. But that's the discussion I wanted to bring forth with leadership with Cahill. Any more questions regarding Cahill, Kakiza Haska?
So that answers a lot of questions that I get asked, Madam Secretary, is the help that's needed out there when members come in for help. We refer them to you guys, and then and knowing what I know now today, or what I found out today, I mean, that answers a lot of my questions about, because they're saying, well, how come the executives are turning me away? Well, that's because you don't have any money in your budget. And so we need to probably look at that and maybe repurpose some of those dollars to where, and I think it's we got to look at it as a priority basis. Maybe prioritize what we can do and what we can't do as far as you guys' budget. Is your guys' budget lumped together? Okay. So maybe if you guys want to bring in some options, that would be good for us guys to maybe look at and talk about and go from there. Because I get a lot of calls on help that the tribe gets or has available to membership, but oftentimes they're denied. But I didn't know why, because I know we approved the budgets and stuff, so now I know there is no money there. So thank you for that information. That's really good on my part. Then I can tell them now that you guys' budget's depleted and we got to figure out something. Thank you.
Haipa, did you remember your question after that, Madam Secretary? Okay. I thought I seen your hand go up. She forgot again, but I'm gonna go over, Madam Secretary.
And also another factor to add in is it's been a hard year, financially for a lot of people. And a lot of people are in need of food. A lot of people are in need of propane and help with their electricity. And what we thought we had in there ran over fast because the price of propane went up. And we were wondering, why did that get depleted so fast? Well, the price of propane went up a lot. So that's another factor that helped to deplete our budget. And, we do help a lot of people. We help a lot of people that apply, but when we run out of money, then we can't help them, plain and simple. But thank you.
Okay, remember that. Or Haipa, floor is yours.
No, well, this is just a different question. You're helping a lot of people, which is really good. I guess what I'm wondering is there the same people coming in more than once at a time and what have you? And then the other thing, I guess, I was wondering is if they have like budgeting, if they help to learn budget. That's just some of the things.
Through my office, I know what she screams. Speaking of my office too, just with the gas cards I help tribal members with is every 6 months. So they don't need to be helped, so. Madam Secretary.
No, actually, it isn't always the same people, because they only get help once. So they get help once, and we have people, working people. Basically, what they used to call them is the working poor. They're barely making ends meet, and they have an emergency, and then they need help to pay their light bill. Stuff like that. So it's not a rotation. Thank you.
Okay, thank you.
Anything else from leadership? Go ahead, Dallas, floor is yours.
So funerary expenses, I do believe, is an allowable expense under ARPA, and we could check with our CPA and Steve Gunn. And I thought this was discussed earlier, but I can't remember what became of it, because I thought that was brought up already. So, it's definitely something worth looking into.
What I recall about that is if a person passes away from COVID, then they can apply for that assistance to get paid for their full expense of their funeral.
Oh, that's through the state. I was talking about the actual ARPA funds.
I don't know anything about the ARPA yet. We have a roundtable tomorrow.
Ross, can you add to that?
Yes, burial expenses are included under section 602 C1A, so that is an eligible use.
So then, Mr.
Well, it
Chair-
doesn't, you don't, the reason how you pass away doesn't have to be from COVID.
And thank you, Ross.
Yep.
And I appreciate that, because that's kind of where I was alluding to, is that it wasn't specified. And then, do we have a budget then of what you guys are looking for these funerary expenses, other than the $600 increase like Curtis was mentioning earlier?
We can put up a budget, Mr. Vice Chair.
We can still use the funds even though we have that service already?
Yeah, you just title it separately as a COVID-19 assistance to households program. And under that, you can have burial assistance or even aid to their beneficiaries, the spouse, children. So you can have multiple parts underneath that.
So, yeah.
Floor is yours, Alice.
This is something I'm definitely amenable to, just would like to see a number and go from there. Thank you.
Kakiza Haska.
Yeah, I mean, I agree, but after 2023, what are we going to do? Because it's still going to be there. So I think we need to really look at it, and maybe there's some savings there in the meantime, but it's still going to be, because the ARPA funding is only up to 2023, so we have to look at further down the road on what we're going to do with that too. So thank you.
Is there, we just need a motion for the KHM for the extra $600. Motion made by Emily Swim to increase our funeral budget through the executive budget for extra $600 just because of that. What the cost
I'll
is.
second that, but I still want to see a budget on that too. So
Pending, you get to include that with your motion pending budget.
Yeah.
Kakiza Haska. Question coming from HIPAA, then all agency.
Yeah, question. She said that price went up. Are people billing, have to pay that extra $600 right now that they've been having to pay? Okay. That's all, thank you. Yeah, and I was gonna question it.
Okay. Go ahead, all agency.
So by increasing this budget, is this going to be a permanent thing? Because we're approving it, but we're not increasing the overall budget over 26 million. So when we increase this budget, where are you going to get it from? Yeah. I mean, that's where it's going to have to come
It's
from.
gonna have to come from ARPA, that's what you're gonna have to put in your motion, because we don't have gaming.
So that was kind of, sorry, Mr. Chairman, may I? So that's kind of what I'm alluding to, is that I want to see numbers. And so approving this initially, it's going to be up to the 4,200, but I guess I should specify, pending the budget. And then, like I said, once we get a number from there, I'm amendable to start using ARPA funds, as Ross just kind of indicated, is allowable expense. So, I mean, Mr. Vice Chairman, how would you prefer that to be worded then, so that it's not going to be confusing with our fiscal year budget?
Okay, that's what I'm asking. Remainder of the ARPA funds, I think if it's not an urgent emergency, it would be better if we took that time, looked at the numbers, looked at the budgets, and planned out how we're gonna spend the remaining funds out of there, because we haven't done that. We took the projects that we had, and we need to be smart with this, and it's a week. And giving the vice chair a little bit of time to look at the numbers, it's a week. So I would ask that, we take that time and give you guys some time to address that. And if we're gonna use the ARP funds, like Kaksiza Haska said, then let's look at that being sustainable. Thank you.
I'm fine with that, Deanne. Like I said, I scheduled a roundtable for Thursday. I know Louie and I gotta go to United Tribes for that board meeting. But I wanted to get a roundtable with leadership regarding the ARPA funds, Deanne, so we can actually have our plan of the rest of the money that we're gonna have, what projects we wanna support. And also I'm fine with that, Madam Secretary, Mr. Vice Chair, if we could hold off on that until that meeting. Emily Swim, would this work basically to increase our funeral budget from 3,600 to 42 pending the budget review?
Yeah, and that's kind of what we were alluding to. I thought Curtis requested that to be part of the motion, so I was okay with that, to see the budget. Right, Curtis?
So basically, the motion is there to support that. On kind of, we get that budget and we figure that out. So we can still figure that out in the meantime, but the motion is still, it would be there, it would cover everything, so.
Mr.
So-
Vice Chair,
Yeah.
did you want to add to that?
No, that's kind of, Curtis hit the nail on the head. That's the whole point of the pending the motion. And then once we get a budget, I think we honestly could just sit how we are now, discuss, is this an adequate ARPA expense? And if it's allowable, and so the thing of it is that, our membership is already going through a tough time. You put on top of that the cost of trying to find the money to bury your loved one. It's a lot of stress and emotion, man, that, it takes a huge toll on itself. And that's something, if I have the ability to alleviate that and their emotion of distress and emotion, I will be more than happy to do what I can. So I am very much for it. If we can use ARPA for the funerary expense help, I am definitely wanting to go that direction. And then in the meantime, like Curtis suggested, we got to think of a long-term game in the meantime, because obviously this is an issue that's going to keep coming up. And so I'm looking at two different parallel roads. We're going to take one to make sure we're getting on the right path, and on the other hand, we're going to make sure we're going to prevent this issue from happening again in the future. That's how I'm looking at it. And so that's where I'm at. So I'd like my motion to still stand pending the budget. Thank you.
Go ahead, Dion, then Mr. Vice Chair.
I think we all have compassion for our members, but things keep coming to this table and you keep making motions without any numbers, a budget, anything. And that's where I have trouble with it, is because we need to plan, we need to be smart, and we need to be accountable. It's not lack of compassion for the membership. And I kind of resent that remark. Thank you.
Mr. Vice Chair.
Can we just withdraw the motion, let me work on it, and we can pass it later? Right now, we have enough money to cover. If you want to make a motion, just make a motion to increase the budget amount with the funds that we have left. And then I can bring something with the ARPA.
Mr. Vice Chair, my motion doesn't mention ARPA. I'm just saying, like,
I know if you don't mention, but you're gonna have to put it in there. Because if you don't put nothing in there, it's automatically thinking gaming.
so that's what I mean pending the budget.
Well, I know, but why are we gonna mess with pending? Why not just wait till I bring something to the table?
I'm okay with that too.
All right.
Yeah.
I was gonna say, yeah, this came to the table. I'm just wanting to know that I didn't bring this up out of nowhere. This came to the table, and it sounded like the executives were requesting assistance in finding additional funding. So I'm trying to just present a solution.
Well, that's what I get too, but you gotta understand that in your motion, you're gonna have to, there's too much work behind the scenes rather than just saying a motion pending. So just let me work on it. That way you guys can make a motion with something in black and white.
All right. I yield the floor for now.
How about then, Louis?
I'm saying, we made motions in the past where it says, we'll let the vice chair find the funding source. We had several of that, when the previous vice chair was in here, Lisa. So I don't see why we can't do that now. And, leaving it up to the vice chair to find the funding. Or which line item it's gonna come out of. I'm just pointing that out.
Go ahead, Louis, floor is yours.
Did BIA give us a bunch of money for funerals in their master contract? You guys need to check on that, and then you probably didn't even draw it down yet. Wasn't that here a while ago? Did you guys draw it down? Well, there
Anything
you
for
go.
burials in the master contract, I believe, goes to child protection, right?
Well, it says funerals. It's for funerals, though.
But it's in the master contract of child protection. But all I'm saying is let me work on it. That way we can have something in black and white before we come.
Kakiza Haska.
Thank you, Mr. Chairman. So I guess that's where I'm coming from too, is that if you guys are bringing this to the table, then I would suggest that we have everything here, like in black and white and stuff too, because I got a mixed message that you guys were coming to the table with a motion to move forward on this.
There's just a little miscommunication because
Okay.
when I was gone sick, that's when they had the meeting
Okay.
with them. If I was here, I would have worked on it before then, so. just
Okay.
Give me a
And
little.
I'm fine with waiting. Do you want a timeline on that too, or can you get it turned around real quick, or is
No, I
it
can do
an
that
emergency,
quick.
I guess?
If you can just make the motion where you approve the extra $600 with the remaining executive budget funds.
I'll amend my motion on the recommendation of the vice chair.
Lindsay, there's amended to the motion, so Emily Sim, Long Hollow, Haiba, question. Call for vote, please.
Dallas Owen,
Yes.
A. Lydia Amos, Louis Johnson, Dion Crawford,
Yes.
Curtis Bissonette.
Yes.
Brandon Gypsy Wana,
Yes.
Lloyd Kirk Jr.,
Yes.
Tribal Vice Chairman,
Yes.
Tribal Secretary.
Yes.
Mr. Chairman, motion passed.
Mr. Vice Chair.
Are you guys okay with putting a starting date of today? Because I don't want, okay, beginning today's date, Lindsay?
You okay with that, Dallas? Okay. Members of the council, I don't want to take too much time because Mr. Vice Chair has his report like 15 minutes ago. There is our executive committee minutes for February 17th for approval.
So moved.
So moved by Oladensi. Second by Iagaka. Question by Kakiza Haska.
Yes.
Dallas Owen,
Yes.
A. Lydia Amos, Louis Johnson, Dion Crawford, Curtis Bissonette, Brandon Gypsy Wana,
Yes. Yes.
Mr. Chairman, motion passed.
Thank you, members of council, executives. So now I'm going to be turning the floor over to Mr. Vice Chair for his report. After that is the budget office. We'll take a break at 10:40, then go into the tribal secretary's report.
Motion to approve your report, Chairman.
So moved by Vice Chairman to approve the chairman's report. We already did that.
Oh, did we?
Oladensi approved it.
Didn't even say nothing. Jeez. Yeah. You got the packet for my report. There's a couple of program reports in there, just updates on what they're doing. You got the check register in the back. And the biggest stuff that I'm going through is with the budget office. Only action items you really need is the ones 1 through 9. These are all grant-funded awards. And then the pending ones, I want to get with the executives at our next meeting to discuss the increase on the gaming ones. Yes.
Do you want the 1 through 9 approved individually?
I don't think any of them need to be approved individually.
So you want it all in one lump sum?
Yeah, it'd be just like how we do the federal awards.
Okay.
All right, members of council, you got his 1 through 9 made by Kakiza Haska.
Question.
Second? All right. Then he laughs at me when I make mistakes.
Okay, I'll question.
Second by all agency, question by Haipa. And that was a motion to approve 1 through 9 with council approval of the following.
Curtis Bissonette,
Yes.
Brandon Gypsy Wanna,
Yes.
Floyd Kirk Jr.,
Yes.
Dallas Owen,
Yes.
A. Lydia Amos, Louis Johnson, Dion Crawford,
Yes.
Tribal Vice Chairman, Tribal Secretary.
Yes.
Mr. Chairman, motion passed.
Thank you, council, executives, Haipa.
I had a question, Mr. Vice Chair. Rights lawyer? Uh-huh. Is this in regards to our civil rights office? Okay. Mm-hmm. So, I guess with that being said, is we're gonna have to reallocate a lot of our budget, being we don't have the total increase from our gaming funds. And would this be gaming funds that would have to fund the civil rights office? That goes into your guys' executive budget too next. Yeah, okay, thank you.
Mr. Vice Chair, floor is yours.
Okay, and then, when you guys started the behavioral health care service program, did this go through Steve Connor? Okay. If you guys just want to obligate out of the ARPA funds, 51,880 for the expenses of the task force, of the opioid task force. Lake Traverse?
Sunny? Yeah.
Table that till Sunny's report? Okay. Then at that time we'll give you guys copies.
Just a little verbal update of stuff that's being worked on. The indirect cost should be here any day. Starting to look forward because it's going to come fast. We need to start doing the fiscal 21 audit. And fiscal 21 indirect cost. RFP for an auditor. And Long Hollow.
Thank you, Mr. Vice Chairman. So, with that being said, we're always behind the gun when we do RFPs. So would that be a necessary motion that we could make today so we can get that process started early? It wouldn't, I don't think it would hurt anything.
I actually got if we have a special session or at the end of the month, I was going to bring it up. I have a meeting on Thursday with all the department heads on RFP for the software. And then the RFP for the audit was also going to be included in that with the programs that are involved with the audit part, like finance and AP and all that. Yeah, I'm just giving you an update on what will be coming up. Haipa?
you said this was in regard, the indirect cost, right?
Well, one of it, some of it, indirect cost, that's been submitted, we're just waiting any day now to get that. But, we have to start working already on the 21 indirect cost and the 21 audit.
Isn't some of that what Renville and Company was working with?
For 2020.
Because we needed that, when the motion was made way back when they were here, was to him to get that indirect cost ASAP, because we needed to get it, and we were in danger of losing whatever funding and whatever, and people made a big deal about it, so I want to know why we don't have the 2021 one, because I was under the impression that that's what the indirect cost 2021 one.
I'm just saying that because everything that's going on right now, 2021 already, because I know I can't remember exactly, but
So, how does that affect going into 22? Well, yeah, the audits, but I mean, right there. All right,
yeah.
21, 22. Okay.
Well, that's what I was gonna. Once I get to have that meeting on Thursday, I'll report to you guys to see if it'll be easier to do how we usually do it in the accounting manuals, 3 years, right? 3 years, or if we're just we need it faster, if we want to just go with the smaller firm, which it looks like we might have to do because all these big firms are pretty tied up. But,
Okay. Thank you.
Meeting with Clarence O'Berry on the 9th. But other than that, that's all I got, besides the reports you got from my programs.
Motion to approve Vice Chairman's report.
So moved by all agency.
Second.
Second by Kakiza Haska. Question by Tokenwa.
Yes.
Dallas Owen. Yes. A. Lydia Amos. Yes. Louis Johnson. Dion Crawford.
Yes.
Curtis Bissonnette.
Yes.
Brandon Gypsy Wanham.
Yes.
Tribal Vice Chairman.
Yes.
Tribal Secretary.
Yes.
Mr. Chairman, motion passes.
Oh, we already did budget this.
Okay. Well, with our agenda, it says budget office, but that was included the vice chair's report, so everybody approved that. Break time, then we'll come back with tribal secretary's report. Don't forget, we got donut food back there. So we're going to go back into Madam Secretary's report. So whenever you get a chance, Madam Secretary, the floor is yours.
Good morning, Tribal Council, executives, and the Oyate. My report is in front of you. And basically the month of February seemed very short because of the snow days. I just had to note though that while we were sheltered in place due to the weather, the decrease in our positive COVID cases went down. So basically the weather actually helped us to slow the spread by sheltering in place. There were 95 people that came to the Tribal Secretary's office for various reasons. We logged in and responded to 205 phone calls, signed, approved, and processed 348 documents. There were 41 scheduled meetings. And there are 2,278 elders listed for the month of February. I attended the Human Services Board meeting on February 8th. It was a very good meeting, and the Human Services Board is anxious to identify initiatives and goals that they would be interested in pursuing for this year. We did not have a second meeting due to the weather, but looking forward to the March meeting. I attended the Patient Advocacy meeting at Indian Health Service on February 16th to discuss issues, concerns, goals of the group. And it was just Randy Jordan, Craig Cantos, and myself. We reviewed the minutes of the last meeting, and the patient concern process is attached to this report for you to copy and take to your districts. And it's behind the youth department's report. And the restructuring and streamlining of a couple of the programs is almost complete. It's going well right now, and I'll let you know when it's actually in place, totally in place. And all the program reports are attached to my report. People are busy. But that concludes my report, but I would like to go into executive session right now, if I could get a.
There's a motion to go into exec session on Madam Secretary in regards to child protection.
Second.
Moved by Kakiza Haska, second by Olinsky, question by Haiba.
Fernandez Bisnet. Yes. Brandon Gibson-Wana.
Yes.
Floyd Kirk Jr.
Yes.
Dallas Owen.
Yes.
Adrian Yanez. Yes. Louis Johnson. Dion Crawford.
Yes.
Tribal Vice Chairman. Yes. Tribal Secretary.
Yes.
Thank you, council and execs, that we were in exec session at 10:55. You ready? Motion to come out of exec session by all agency. Second by Emily Swim. I'm not even acknowledged, Long Hollow. That's a question at 11:58.
Floyd Kirk Jr.,
Yes.
Dallas Owen,
Yes.
A. Lydia Amos. Yes. Louis Johnson. Dion Crawford,
Yes.
Curtis Bissonnette. Yes. Brandon Gypsy Wanna,
Yes.
Tribal Vice Chairman,
Yes.
Tribal Secretary.
Yes.
Mr. Chairman, motion passed.
Thank you. Motion to approve. Motion to approve, Madam Secretary's report.
So moved, Mr.
So
Chairman.
moved by Dion. Second by Kakiza Haska. Question by Emily Swim.
Dion Crawford,
Yes.
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 Think I have to separate Louis and Susie. They're always talking and getting us all focused. All right, Brian, I apologize for the wait. We're going to go back into our agenda again. Facilities, I know he's this needs support from leadership.
Good afternoon, leadership. I was trying to come here about a month ago, but our vendor didn't have a license. It wasn't up to date as we went through procurement on this. And the valve dropped in the skid steer. And so at the time I spoke to the chairman about it, and we were looking at options for a new one. But the same machine is $32,000 higher than what they're valued at, just because of the way COVID is. So when we took the machine up there, they got through procurement and sent back an estimate, so the machine hasn't been touched. And once we get the okay, then they'll go for, move forward on fixing the new engine. And if you look on the back, it tells how many hours are on it, and according to this guy, we got 400 more hours than what normally goes with these skid steers. And so he had said that the machine is still worthy of getting repaired. So I come to ask for a motion to move forward with.
So moved, Mr. Chairman.
So moved by all agency.
Second.
Second by Kakiza Haska. Question by Dion Crawford.
Yes.
Dallas Owen, A. Lydia Amos. Yes. Louis Johnson. Dion Crawford,
Yes.
Curtis Bissonnette. Yes. Brandon Gypsy Wanna,
Yes.
Tribal Vice Chairman,
Yes.
Tribal Secretary.
Yes.
Mr. Chairman, motion passed.
Thank you, leadership. Anything else, Brian? I appreciate you taking the calls after hours to help our membership out there using our equipment. Thank you, Brian. Motion to approve facility management report.
So moved.
So moved by Dion Crawford. Second by Louis Johnson.
Question?
Question by all agency.
Yes.
Curtis Bissonnette. Brandon Gypsy Wanna,
Yes.
Floyd Kirk Jr.
Yes.
Dallas Owen, A. Lydia Amos,
Yes.
Louis Johnson. Tribal Vice Chairman. Yes. Tribal Secretary.
Yes.
Mr. Chairman, motion passed.
Thank you, council and execs. Going on to, is their program here? If not, if the DARE program's not here, I'll try to get them after our lunch break. So Randy, if you have a short report for leadership before the lunch break, the floor is yours.
Are we ready? I'm going to talk, yeah.
Yep, floor is yours, Randy.
Thank you, Chairman, leadership, and council for this opportunity. Myrna had sent me a text asking about the Joint Commission report that was an unannounced survey on November 18th. Unfortunately, I haven't got the approval to release that report. I think you asked for that in December or so, and I asked my chain of command. But I can kind of talk off the record if you want, and I'll be brief. So that's just my report. A couple of updates. Yesterday we had a new nurse practitioner start, Tina Evenson. She's originally from, I think, Minnesota. She worked as a locum here a couple years ago. So she's from this area. Unfortunately, Tanisha Lancaster left us and she went to Pine Ridge. So it's a net zero for plus minus in the month of February. Medical staff consists of 9 permanent providers, some part-time, some full-time, and 2 contracted providers. We're working on another permanent hire, knock on wood. They come mid-March, but I'm not going to hold my breath until the background is cleared. And I know we have a locum that's interested in working for several months. We're trying to get credentialed as well. So hopefully in the next couple of weeks, we'll have a couple more providers on. One's a physician and one's a nurse practitioner. Unfortunately, a couple of our pharmacists have left. They were a young couple, transferred to Oklahoma. They're commissioned officers and they're looking for promotional opportunities. But on the flip side, we did hire a pharmacist that's, I think she's originally from Sisseton, and enrolled member, and we're waiting to clear the background. Hopefully that person starts mid-March. And we have a couple of vacancies in pharmacy techs. The Commission Corps deployed 5 officers to the service unit, one physician, 1 dentist, 1 hygienist, and 2 pharmacists. And they'll be here for 30 days. And it sounds like we'll get another dentist after 30 days. I think they're coming from Cass Lake. It's a nationwide deployment due to COVID. So we're glad to have those providers with us. Access to care. So when the survey came in November, there was basically 7 complaints. They were grouped into 3 categories. One category is HR, it had to do with credentialing, which is making sure that the providers have licenses and certificates, and we have those on file. Making sure that when we reappoint someone from one appointment to the next, that we're doing peer review to make sure that their work is good. And the next thing that they found was that we had given someone some privileging for services that we did not provide. And so going through those HR files, those credentialing files, we've put in corrective action plans so that we've reconciled our privileging application process. So whatever we provide in optometry is what we're going to privilege them for, et cetera, for all of our departments. They weren't very severe deficiencies, but they were deficiencies nonetheless, and we got those remedied. I also want to say that the Joint Commission report was due back on January 29th. We sent it in on January 28th, and on February 10th, the Joint Commission received our report and accepted it with no further action. There was another category was we were deficient in leadership, and leadership had to do with access to care, continuity of care, and internal communication and employee conduct. And so we've subsequently did some employee surveys, identified strengths and weaknesses, identified issues and solutions, And we're putting together a remedy for that as well. Since last fall, I think we've hired several staff, permanent and locum, to help bolster the access to care issue. And then the last one was a patient care complaint, and it had to do going back to access to care with someone who did not receive their medication on time because they could not get an appointment. So of the 7 deficiencies that were cited, 3 were HR dealing with credentialing, 3 were dealing with leadership directly involved with access and continuity of care, and 1 had to do with medication management because the patient didn't get their medicines on time. So if you boil it all down, it really is a lack of providers and access to care. So as I've been saying the last few months, the efforts to hire new staff, to get more contractors in, seems to have paid off, because moving forward, hopefully by mid-March, we'll go from 11 staff to 13 staff, and then continue to build on to that as well. We've also updated the outpatient scheduling policy. That seemed to be outdated, and we weren't following it very well, and that did create some bottleneck in scheduling. And we also started publishing the medical staff provider schedule 30 days in advance. What was happening was, due to the lack of permanent providers, due to the lack of providers, we weren't able to publish a schedule until like a day before the new month, and that prevented schedules into the appointments into the future. So the goal now is April's schedule is posted by March 1st, and matter of fact, we have April, and we're working on May's schedule now. So adding more staff, updating this scheduling policy, and getting the provider schedule published in advance will help with access and continuity of care. I did survey our medical staff, our clinic staff, after the Joint Commission report, and I asked for their top 5 issues and top 5 solutions. And I talked to nursing, medical, pharmacy, physical therapy, radiology, and lab. And their number 1 concern was of others, understanding others' roles and responsibilities. Nursing doesn't fully understand what lab does. And I'm making this very simple. Lab doesn't know what radiology does, et cetera, et cetera. So we're putting forth training, open houses for each department so that each department can have a better understanding of what their other department staff does. Communication was another one of hot topics. Since then, we've made it mandatory for all meeting minutes to be published to the shared drive within 10 days, and that everybody has access to those meeting minutes. It's an opening up way of communication. The third was managing employee conduct. So if someone was, bad behavior, bad performance, to make sure that we're managing that more timely and more expeditiously. Unfortunately, for the conduct part of it, we have to go through the Employee Relations Department in Aberdeen, and I think they only have 4 people, and there's 2,200 employees in the Great Plains area, so it's really a supply and demand, but we're putting more pressure on area to get those conduct-related issues through the process. Provider schedule and scheduling, which I talked about, and the telephone system. We actually had a vendor and area IT person down here mid-January to look at our telephone system. The building is 13, 14 years old, the telephone system, the hardware, the software is getting old, and we may have to purchase some new equipment, but they did find a couple of snafus within the system of how it was set up, but it still is a ways to go, but it's on our radar, and we're trying to fix that. So I'm trying to be brief. Any questions? Yes, sir.
Go ahead, Dallas, floor is yours.
Oh, this is a little switching gears from your report, but out of curiosity, just for the record, IHS employees do not receive hazard pay and or premium pay, correct?
We don't receive hazard pay anymore. That probably ran out about a year ago. We offered it for about maybe 10 months, maybe from March, April of 2020 to like February 21. And this came from headquarters and Office of Personnel Management, way above the area office level. But so.
Yeah, I'm aware of that, and then I was just doing my due diligence and double checking potential with that. Could you potentially request that? And I'm guessing they'll have to go up the ladder. Is that something you're able to do?
Well, yeah, I'm able to send it up the chain of command, but again, that decision was made above the department level, so, but I can mention it during our area director call on Thursday.
I would certainly appreciate that. I know that we have several tribe members working there, and
Yeah.
there's some animosity between the premium pay received here and at D&G as well as IHS.
Yeah.
So I get it.
Yeah.
So I just thought I'd ask.
Yeah.
All right, thank you.
And as far as premium pay, we do have people who, have night differential if you're working until 8 o'clock at night, Sunday differential as well, and then double time when we work on holidays. So there is that aspect of premium pay as well. Okay. As far as the COVID update, you can see in the chart here, we finished January with a positivity rate in the facility, the patients that we tested at 29.7. We finished February at 30%, so really no change with the 1 out of 3 people coming in for a test tested positive. But the positive, looking down on the blue chart below, is that the last week of February, there was only an 8% positivity rate compared to 33, 33, and 45. So it looks like it's a nice downward trend. If you take a look at the state data as well, the state finished January with 47,000 positive cases. They ended February with 9,400. Obviously, there's three days less of reporting, but the daily average went from 1,523 new positive cases in January to 338 in February, so that's a huge decrease. So we're hoping that we continue to see that decrease as well. I don't have it in my report, but we've given the DARE program and Dakota Pride numerous cases of home testing. Whenever we got a shipment in, we'd give them half, so hopefully they kept them well stocked as well. Roberts County finished the month with 171 new positive cases and 100 active. The Omicron variant is more contagious, but is less lethal, less deadly, and it also helps if you have been vaccinated as well. Vaccination, we're at about 46% of age eligible, that's 5 years and up. You can see by the age groups there, the elders are the ones 50 and older are the ones more compliant with the vaccine. But overall, we're about 46%. Ideally, the herd immunity is around 85 to 90%, but it is what it is. And hopefully we have enough people out there. I think the state itself has around 71% that have at least one shot and 60% that have at least 2 shots statewide. Monoclonal antibody treatment, we started giving that out in January. I know Secretary had asked some information about that, I think on a text message a couple weeks ago. Nationwide, there is a shortage of the treatments, and so there is a kind of a priority listing, and I listed that, and I shared it in last month's report as well. But basically, we've probably, I don't know how many we've given, but we've given several. And matter of fact, I just had a patient call me last Thursday and gave us a compliment on their infusion. They were not able to get vaccinated due to an allergic reaction, and they come down with COVID, and they got the infusion, and they felt really good, and they gave us thumbs up on the people who provided treatment to them. But basically, you're older than 65, you're obesity, diabetes, and you have other underlying health conditions, you move up the priority list. As the medication, the antibodies become more available, then we'll give it out on more freely. Really, that's about it. Any questions for me? I guess the good news is that we hopefully we turned a corner with coronavirus. Time will tell. We're making some improvements internally for communication, staffing, access to care. It's going to be continued work in progress, but we're really taking that. And last thing is that we're looking at just culture, a safe culture, providing training on how people can report errors into the system, and what do we do with that information to make corrective measures moving forward.
Gypsy, floor is yours.
For the monoclonal antibody treatment, for that, do they have to meet all of those requirements, or if they meet even one of those?
Yeah, well, it's a supply and demand, and, you know, it's basically one or all. So if you're really sick, if you're obese, you know, it's kind of like, I'm stumbling here, but they don't have to meet all of them, is
Okay.
what I'm trying to say. And as it comes more available, then we're gonna give it out more easily. But it's basically, we have to prioritize the usage.
Okay, thank you.
Leadership, anything else for Mr. Jordan? No questions or comments for Mr. Jordan. Is there a motion to approve Randy's report?
So move.
So moved by Olegacy. Second by Iagata. Question by Madam Secretary.
Floyd Kirk Jr.,
Yes.
Dallas Owen,
Yes.
A. Lydia Amos, Louis Johnson, Dion Crawford,
Yes.
Curtis Bissonette,
Yes.
Brandon Gypsy Wana,
Yes.
Tribal Vice Chairman, Tribal Secretary.
Yes.
Mr. Chairman, motion passed.
Thank you, Randy. Next we have Sunny. After Sunny, we'll take our break before DCA comes in. All right, Sonny, whenever you get a chance, make sure your mic is on. We have a listening audience out there, so floor is yours.
Okay, good afternoon. Would you like to do the opioid, or should we wait for the Vice Chairman to come back?
If it's ready, you go.
Okay, we'll just go through the DARE report. The current issue that we were having is that we were having a hard time getting medication for our children, and I mean off-the-shelf, over-the-counter medication, and so we have a quote request inside your pamphlets there that one's from Lakota Enterprises and the other one's from Bowie Foods. We do have a memo stating that we have to use Bowie Foods, but Bowie Foods quote is a tad bit higher than the Lakota Enterprises for the same product. You can see the difference. They're both in there. It's a significant difference. It's about a $12,000 difference. So I'm looking for a motion to approve the Lakota Enterprises.
Any questions or comments before I ask for a motion?
So moved, Mr. Chairman.
So moved by Dion Crawford. Second by Susie. Question by Olegacy.
Dion Crawford,
Yes.
Curtis Bissonette, Brandon Gypsy Wana,
Yes.
Floyd Kirk Jr.,
Yes.
Dallas Owen, A. Lydia Amos, Louis Johnson, Tribal Vice Chairman, Tribal Secretary.
Yes.
Mr. Chairman, motion passed.
Thank you, Council Execs.
Okay, as we continue on, right now we have, as Randy Jordan stated there, we have a total of 9 families on our list right now, and that's just a significant decrease over, we had a 7-week span where we were averaging 50 to 70 families on our list, and it was pretty steady, and it was a long 2 months. Also in your packet there's a report with the rooms and the issues that we've been having with them. I updated the executives. They asked me to give a report on the things with the construction. It still isn't finalized, but we thought we would get you a draft just to see what we were dealing with the rooms. We've been working with facilities with Breon, and also he's been in contact with the architect and the construction vendor that dealt with building it. So we just wanted to make sure that you were aware of the situation at hand. And dealing with the families, you know, with the road closures, we had to, just wanted to update you, we had a little bit of trouble with the travel when there was no travel advised. And then I was getting into the sales, the supplies and equipment. The first ones, we just got the motion for the medication. The second ones, we received 500 oximeters from the Tribal Health EOC team out of Rapid. That was really nice to have, and it was also kind of hard to find the oximeters, and they were donated through the EOC through the main supply. So we just wanted to update you on that. With the help of EMS and facilities, we picked up 80 plus beds from a company out of Brookings. There's single beds. We put them at the warming shelter, and we put them at the homeless shelter. And we have a supply of some at the SWO building. So, and with the budget, I just wanted to, and I won't meet with the executives, but I just wanted to bring the attention to the leadership that we wanted to develop a self-care plan for my staff. We've dealt with a lot of situations and a lot of scenarios that were pretty tragic. There was, you know, the response and being able to take care of the people that are taking care of people is really a high need on recovery. And that recovery is ongoing. You know, right now we're still responding to COVID. You know, we were responding and then we got into recovery, and then the Delta came out, then the Omicron came out, so then we had to switch from recovery back into response. And now as it's starting to slow down, now we're kind of moving into the recovery and evaluation on how we responded to those two variants and what we can do better, and, you know, and how we can provide better services to our tribal members. But also in doing that, I need to make sure that I can take care of my employees. So I would like to, with the budget form, I'm probably going to ask a request just to provide some training and some opportunities for them to receive resources on taking care of themselves on the things that they dealt with, you know, and that goes from just, you know, different things that were implemented that we had talked about with mental health with Norman, you know, the counseling, the providing opportunities for, you know, for that self-healing.
Sorry about that. Go ahead, Hi, the floor is yours.
Thank you. Just, you're talking about self-care stuff. That's important that we have that employee assistance program. I don't know, did we hire for that again after Don? I think if we don't have somebody hired, I think that's something we could get as a contracted hire. There's companies out there that do employee wellness things. But I mean, because that's really important, obviously, for the DARE program, but I think for the rest of our employees as well. And when we used to have it, I know people utilize that program, and that also includes self-care. So I'd like to put that forward, that execs work on getting that employee assistance program up and running. And that's all. Thank you.
Thanks, Gypsy. Anybody else for Sunny? Go ahead, Dallas, floor is yours.
And so, Sonny, just to double check, the budgets in front of us are unrelated to the self-care budget proposal that you're talking about, right?
No, the budgets that are in here are for the next conversation with opioid.
I just wanted to double check.
Yeah.
Okay,
No, that's something that I would just like to give you a heads up on, that we will collaborate and probably create. So, I mean, it's going to have to be a whole structure of, and how we can track and the improvement of the employee. I mean, you know, the progress and how it makes a difference in their potential of their output as an employee.
No, you bring on some really good points, and honestly, that's something that I've thought about. I know I was just an office manager in behavioral health, but, you know, there's a lot of burnout in those kind of services, and you see it. And I won't exactly make a motion just because I understand that there's a lot of behind the scenes work that'd be required, but I think if the executive committee could kind of work on a separate policy altogether, try to work on a mental health day as a tribe. Like, not everyone take that, but, you know, when it comes to, like, illness and personal time off, you know, the burnout be real. And so, like, an individual, if they're able to just take, like, a mental health day, I think that could go a long way when it comes to the overall health of our community members overall. So maybe that's just something you guys can visit sometime. I don't know. Just throwing an idea out there. Thank you.
Thank you, Dallas. Going on to Deanne.
Thank you, Mr. Chairman. So when you talk about burnout, you talk about self-care, that's a separate thing in and of itself. As a counselor, you do self-care plans that are, and we always use the medicine wheel, where it's mental, physical, emotional, spiritual, and you do your self-care plan that way. And as a supervisor, you would be responsible for developing those self-care plans with your staff and then making sure that they're adhering to them, because one of the things that happens is that people aren't good at adhering to the self-care. And so it would be, that's generally normally how you do it when you work in a field that has a high burnout rate. So it's more than just a day, it's a plan that, and goals that you meet weekly. And I can give you resources to assist with that as well, if you need them. Thank you.
Anything else for Sunny? Other than that, I'm going to ask Sunny, go ahead. The floor is yours.
Okay, we're gonna, that's pretty much what I have for the day report. We're gonna switch into the conversation of the opioid task force request. And maybe I can have Dion start with the conversation and we can fill in with me and Eddie on the side of it.
Thank you, Mr. Chairman. So this was developed as a proposal. I first consulted our technical assistants as well as Mr. LeBlanc and our vice chairman before drafting this. I am going to be doubling this amount. So the 51,880 will actually be times 2 because it'll be for 2 years. Which is, and it's basically, I mean, you could read it yourself, but it's 103,760. Basically, it's for travel training for the team as well as facility rental, equipment, duplicating costs, for the staff, for the team to be able to do the work that they need to do. And Chairman has graciously agreed to oversee the budget. So I'm just looking for a motion for, what did I say, 103, sorry, my phone dropped, 103,760 for 2 years, allocation out of ARPA. Thank you.
Thank you, Dion. Question going on off the floor from Dallas. Floor is yours.
So the only question I have on the budget is I'm a little confused on the work performance award since there's no personnel line. So I was just kind of curious about that. Because, yeah, it's 4,500, and so if we're going to be 2 years, so that'd be 9,000. But I was just, it's considered a work performance award, a one-time cash, but I was just like, who's that going to? Since there's no personnel designated in the budget. So I was just kind of curious about that one.
Go ahead, Dion.
Thank you, Mr. Chairman. So these individuals are, and I'm not going to name them, and I think we discussed some of that when we were in executive session, why we are not going to name them. But they are taking on additional duties. That doesn't mean that they will be given that award, but that means that it's there if we decide to, if Chairman decides that they get that work performance because it's additional work.
I think it's like a stipend for the meeting or the progress of scheduling the meetings that you have over the time. I think that's the intent of what it's intended for.
Anything else, Dallas? Okay. Went over to Gypsy. Floor is yours, Gypsy.
Thank you. Yeah, I had that same question as Dallas, but I'm also looking at the health insurance and stuff. Who is that supposed to be coming, the fringe benefits? Because the way this is, I see it as another department being developed, and this isn't a department, it's a task force. These are all volunteer members, and as they are already employees, some of them with additional duties, that it already kind of includes their job description a little bit since they're in that area of that field, community health, education, behavioral health, et cetera. And as employees, they already get a performance or bonus award or Christmas award already. And so so that's what I'm thinking about on them awards, but what's this with the fringe benefits? Who does that go to? Since there aren't any specific employees hired for this task force.
Go ahead, Sonny.
I think the fringe benefits are going to be your taxes that you have to pay because it would, even if you had a stipend form. I don't think this is a department. I think it's more set up as an advisory committee or even as a committee that it's structured so that those stipends would have to be taxed, that you would have to pay the taxes on it.
So you're saying, no, if this is, I just don't think those stipend things should be in there because these are people that are working during the day. A lot of these things happen during the day. This isn't a stipendable position. And if it were to be so, then we better put it up for election from the rest of our districts because this is a task force working on an important thing and it's already part of their duties. She said it's extra duty, so therefore that would take care of the fringe benefits part of it because nobody would be getting a stipend. So that's it for now.
Thanks, Gypsy. Go ahead, Dallas.
Conversing with Madam Secretary, I think a more appropriate approach would probably be to fund the line item honorariums. And maybe that will just help because, work performance award is, yearly evaluation type thing. But if it's an honorarium, you did something extraordinary out of your balance, and I feel like that would be more readily acceptable in my opinion. I'm just throwing that out there.
Madam Secretary.
Yeah, I think that would be a more appropriate approach to take. Just take out the work performance award and the fringe benefits, take all that out and just build in an honorarium line item and give them honorariums opposed to stipends because stipends doesn't fit with this budget. Because all of these are employees like she mentioned, and they already have fringe benefits, they already have a salary, and they already have work performance. So it would make more sense to build in an honorarium line item and put that cost in there and just give them honorariums. That's what I think, to be safe. I don't know what the vice chair thinks. Thank you.
Yeah, can you just change that then?
Yeah, that's a simple fix.
If that's okay with Mr. Vice Chair. Go ahead, Gypsy.
So, I would like to officially be part of the task force so that I can be eligible for an honorarium.
Go ahead, yeah.
I'm trying really hard here. The 9 individuals that are getting honorariums are employees. And they might not get honorariums. That will be up to the chairman. And I put that in because I see them going above and beyond. I see that this is a daunting task. This isn't easy. These meetings, Ms. Chairman, Long Hollow and Bikuli can attest that these meetings are not easy. It's not easy to sit and talk about what's happening in our community. And I just can't believe I'm having to say that. Thank you.
Go ahead, Curtis, floor is yours.
I wanna put something on the record and make something perfectly clear, is that I did not sign up for this to get any honorariums or get any paid anything. I did this because I care about our community, number one. Number two is that we, as leadership, that's our job and our duty. That's what we take an oath to the Constitution for. So to sit here and make a joke out of this it's not funny. It's not funny. This is serious stuff that's going on in our community that we take the time out of our day to do. And if people are going to sit here and cut down this thing and start nitpicking at it, then just allocate a budget and let's just approve it and we'll be done with it. But it's not funny to sit here and cut things down like this when our people are suffering out there. It's not a joke. It's not a joke for anybody to say, well, I want to be on this because I want to get an honorarium. That's not fair to our people. And we need to stop that. It's not funny. Thank you, Mr. Chairman.
Also, too, I didn't see this as us, the leadership, getting a stipend. Is this to see the members of this team out there going beyond, because losing a young person to an overdose is one too many. And there is strong people with good hearts that are on this task force. And it's once we meet, it's straight work, 1 hour, and we get things done a lot. And actually, we have a lot of people meeting with the sheriff's office in town. Other people besides our community members on System Opioid they want to be part of this because it's happening in their community outside of our boundaries. So myself, looking at concerned members of this team to be proactive to help the fight against the opioid abuse of our members is, yeah, it's not funny. I mean, it's hard to hear that. Right away it goes politics. We need to cut politics off this, and we're here for our membership. Thank you. Go ahead, Gypsy.
Okay, let me make this clear. Number one, I wasn't making a joke. And number two, you don't have to tell me how important this is. I agree, and I've been on this other forces when I was in the community health education program. And drugs have been a problem for a long time. And when we would meet at that program with Sarah McGregor, they talked about the drugs coming this way. What are we going to do to combat this? And at that time, people just sat there and were going to let the wave come crashing down. I asked, what do we do? How do we prevent this? How do we fight against it to come back? So I'm not making fun of this and I'm not making a joke out of it. But what I am saying is we don't need to be putting in stipends or budgets or whatever that is that we're titling it here. I'm fine with passing a budget for travel and training. But as far as those other things, I don't think it needs to be in there. And when the time comes, out of that budget, it can be reallocated for a special thing later on. And you're right in calling it an honorarium. That's all I'm going to say about that. And I'm not, yeah, I was being facetious about being on that board, but, you know, we all care greatly about this issue and this task force. To narrow it down just to the few people that are on the task force, doesn't say that the rest of us don't feel as strongly about it.
Dion and Downs?
Thank you, Mr. Chairman. And I added that in without consulting anybody, because I felt that if the task force members, it came to a point where they deserved an honorarium, that we would have the funding to give it to them. It is hard work. It's not easy. And as far as accepting new members, we have a good group going, and I don't see the need to add any more members. Of course, that will be Chairman's decision, not mine. Thank you.
Dallas.
Mr. Chairman, I'd like to make a motion to approve the opioid task force budget for 2 years with the recommended changes regarding work performance as well as the fringe benefits.
Motion made by Ms. Sims, second.
Changing it to honorariums.
Rewording it to honorarium.
Second.
Second by, Dion.
Question.
Question by Latency.
Dallas Owen. Yes. A. Lydia Amos. Yes. Louis Johnson. Dion Crawford.
Yes.
Curtis Bissonette.
Yes.
Brandon Gypsy Wanna.
You said, to approve it and change that bonus thing to honorariums, right? Yes.
Floyd Kirk Jr.
Yes.
Tribal Vice Chairman. Yes. Tribal Secretary.
Yes.
Mr. Chairman, motion.
Anything else, Sonny?
Funding for that ARP?
Yes.
Is that what we decided? That's ARP's the funding for it? Okay, so I'll get with Mr. Gunn and get clarification and make sure that everything's in line. Any of that, I just want to thank you for today.
We need a motion from council that, so we can pay the IT bills. I know there was the phases and whatnot, but we still have to pay bills. Just that, from the executive memorandum that we did to the IT department, and then I just want reassurance for our motion from council so that we can pay the bills that was made after what was the 900,000. Is that what it was?
Yeah, well, they consolidated already, so we're looking for a motion to support the executive memo that the chairman had on January 12th that approves his signature on the project for future payments on it. So we're just looking for to authorize the chairman to make payments on the IT project that would support the executive memo that we had on the 12th of January. Because you consolidated phase 1 and phase 2 back in, I believe, in December, if I'm not correct. But you consolidated the project. Ms. Drum presented it. You guys approved it. We're just looking to for approval for the chairman to sign off on the future payments of the project. And I think there's probably about, I want to say less than 100,000 left on that project for payments.
Curtis, did you have a question or comment? The floor is yours.
Thank you, Mr. Chairman. So is that out of the CARES funding or is that out of ARPA?
That's out of ARPA.
And that was, when did you say that was? Last December or this past December?
This past December, that you consolidated the project that, remember there was a conversation of phase 1 and phase 2, right? That was on the table. Phase 2 was never approved. We only had phase 1 approved, correct?
Yes, there was no talk about a phase 2. So my question is, why are we talking about a phase 2, and where did that conversation start from? Because it was always the whole building itself, and that was, to me, was phase 1. So.
And it still was phase 1. Phase 2 was developed. Yeah. Do we want to get into that discussion? I mean, well, we're all aware of the situation. We're not trying to, we're just looking to have authorized, for the chairman to authorize future payments of the IT project.
So moved, Mr. Chairman.
This is just cleanup stuff that we're trying to do.
Second.
Motion made by Dion, second by Latency.
Question.
Question by Kakiza Haska.
Motion will be to give the chairman signature authority to pay future bills of the IT project.
Before I call for a vote, Lindsay, we go for a question over by Dallas.
And just for the record, this is all within the original budget then?
Yeah, we got that passed in December.
Okay.
The money's there, but, go ahead to pay it isn't there.
Go ahead, Lindsay.
Dion Crawford,
Yes.
Curtis Bissonnette. Brandon Gypsy Wanna,
Yes.
Floyd Craig Jr.,
Yes.
Dallas Owen. A. Lydia Amos. Louis Johnson. Tribal Vice Chairman,
Yes.
Tribal Secretary.
Yes.
Mr. Chairman, motion passed.
Thank you, Councilman Execs. Anything else, Sonny? Motion to approve the day report. So moved by Dallas Owen,
Second.
second by Junior Kirk. Question by Buffalo Lake, Louis Johnson.
Amos. Louis Johnson. Dion Crawford,
Yes.
Curtis Bissonnette. Brandon Gypsy Wanna,
Yes.
Floyd Kirk Jr.,
Yes.
Tribal Vice Chairman,
Yes.
Tribal Secretary.
Yes.
Mr. Chairman, motion passed.
Thank you, Councilman Execs. Just remind you that we're gonna take a late lunch break. We'll be back for DCA at 1:40.
Okay, we'll come back into session, 2:13. DCA.
Good afternoon, Vice Chairman, members of council, Tribal Secretary. We'll go to old agency first.
Oh, Padamia. TFP Old Agency District meeting was held on February 28th last night. Motion number 9 made by Angie Johnson to discontinue import and export tax from DMC given fuel leak no longer a credit. Number 10, motion made by Felix Renville to support the athletic complex at TZ with a bonding and grants being used for financing. Motion number 17, accepting youth membership as listed. Motion number 18, accepting adult membership as listed. That is all we have.
Motion to accept Old Agency District. Motion on the floor by Old Agency. Second by Enemy Swim. Question by Lamalo.
Floyd Kirk Jr.,
Yes.
Dallas Owen,
Yes.
A. Lydia Amos, Louis Johnson, Dion Crawford, Curtis Bissonette, Brandon Gypsy Wana, Tribal Secretary, Mr. Vice Chair, motion passed.
Thank you. Okay, Mr. Chairman, we'll move on to Enemy Swim.
Good afternoon. Enemy Swim District had held a meeting on February 28th. Motion number 2 to approve and accept the new members and to relinquish members as requested for attached. Motion number 3 to accept the resignation of Bonnie Fremont from the Constitution Revision Committee. Motion number 4 to have the Secretary's office get the information out on why the money from the on where the money from the rebate program goes and how much it is. We're talking about that rebate program from the Walmart card. Motion number 6, that our councilmen find the money to repair homes on the Lake Traverse Reservation that are in need of repair. Motion number 7, to advertise for a case manager for the SWO Elderly Affairs. Motion number 9, to audit Fuel Inc. to help show where the business is in trouble. Motion number 10, a motion was made to have Fuel Inc. discontinue receiving the tax, 20%, 50%, 100% DMC fuel import-export until after the audit, and that these funds go into an account until after the audit is complete.
Is there any other questions, council? If not, floor is open for a motion.
Motion to acknowledge the receipt of the Enemy Swim minutes.
Motion made by Enemy Swim. Second by Big Cooley. Question by Buffalo Lake.
A. Lydia Amos, Louis Johnson, Dion Crawford,
Yes.
Curtis Bissonette, Brandon Gypsy Wana,
Yes.
Floyd Kirk Jr.,
Yes.
Tribal Secretary,
Yes.
Mr. Vice Chair, motion passed.
Thank you.
Okay, we'll move on to Long Hollow.
Good afternoon, council, secretary, vice chair, and all council. I have a lot here, so I'm gonna try and get through this quickly. On November 23rd, motion number 1, to reaffirm this youth to adult membership, there was 12 listed.
Motion number 2, also to reaffirm Youth 2 membership, and that was 4 there. So now I'm going to move on to December 15th. Motion number 1, we have 7 youth memberships. Motion number 2, we had 1. And now I'm moving to January 10th. And we had no membership there. February 9th, nothing. February 11th, we had 3 relinquishments. In February 26th, we also had 3 relinquishments.
Any questions, council? If not, floor is open for a motion. Motion to approve. Motion by Long Hollow.
No, I have February 26th, 16, 17, 18, 19, and 20 for removals. One was Wanda Varnes as general manager, Weston Quinn as CFO, Kurt Schmidt as CEO, and Chris Cooley as corporate HR, and Nicholas Simon as HR. Thank you.
We have a motion by Long Hollow to accept February 26th. Second by Inwood
Question.
Swim. Question by full agency.
Curtis Bissonette. Brandon Gypsy Wanna.
Yes.
Floyd Kirk Jr.
Yes.
Dallas Owen.
Yes.
A. Lydia Amos. Yes. Louis Johnson. Dion Crawford.
Yes.
Tribal Secretary.
Yes.
Mr. Vice Chair, motion passed.
Thank you.
Okay, we'll move on to Veblen.
Veblen District had its regular meeting on Sunday, February 20th. Motion number 2 for the Tribal Secretary's Office to do assessment on Little Steps Daycare to include the director's qualification, wages, operation, and seek funds for increased pay. Motion number 3 for funds to be reimbursed or credit given to families who were paying Little Steps Daycare even though they were closed, and to amend the Little Steps daycare policies so the parents and guardians are not charged when the daycare is closed. Motion number 6 is to accept adult membership as listed. Motion number 8 to accept youth to adult membership as listed. Motion number 9 is to have 1,000 COVID-19 tests distributed to Haipa District from the DARE program. Motion number 10 for IHS CEO Randy Jordan to provide council and the districts a more detailed monthly report to include wait times, no-show rates, appointment schedules, and information on recruitment efforts of Native people. Motion number 11 for IHS CEO Randy Jordan to provide a copy of the Joint Commission's report to the district and council by March 2nd. Motion number 12 for council to never discuss in regular session or executive session personnel issues or concerns with non-contracted employees and tribal employees in accordance with the SWO personnel policies.
Motion number 13 for judicial to return to the old process with the representative from each district and to follow the legislative process that was previously in place. Motion number 14 to request tribal council hire a special attorney consultant to address past due bills of the system up to tribal members of Roberts County Jail and Roberts County Public Defender to get the bills written off. Motion number 15 for council to amend motion number 59 from their February 2nd, 2022 to include district executives, officers, and employees retroactive to March 2020, and to have DCA and the executive determine the hours of pay. Motion number 16 to vacate the Human Services Board. Motion number 17 to appoint Winfield Rondell to the Human Services Board. Motion number 18 to discontinue giving 20, 50, and 100% DMC importer-exporter tax to Fuel Inc. in accordance with the SWO tax code. Motion number 19 to perform a forensic audit on Fuel Inc. Motion number 20 to request an expenditure report on ARPA funds, specifically to include premium pay. And motion number 21 to define the criteria for premium pay to receive $3, $7, and $10 of premium pay. That's all.
Thank you, HIPAA. Floor is open for a motion to approve minutes from HIPAA's regular meeting.
So moved, Mr. Vice Chair.
Yeah. Motion made by HIPAA,
Second.
second by all agency. Question by enemy swim.
Yes.
Floyd Kirk Jr.
Yes.
Dallas Owen. Yes. A. Lydia Amos. Yes. Louis Johnson. Yes. Dion Crawford. Yes. Curtis Bissonnette.
Yes.
Tribal Secretary.
Yes.
Mr. Vice Chair, motion passes.
Thank you.
Okay, Mr. Vice Chairman, Buffalo Lake had their meeting on Sunday, February 27th. We only had one motion. Was that the Buffalo Lake District support the Enemy Swim Day Schools expansion project with the matching funds of $4 million match from the ARPA funds. And we had no relinquishments or memberships.
Okay, thank you, Buffalo Lake. Floor is open for a motion. Motion by Buffalo Lake, second by enemy swim. Question by Big Cooley.
Louis Johnson. Dion Crawford. Curtis Bissonnette. Brandon Gypsy Wana.
Yes.
Floyd Kirk Jr.
Yes.
Dallas Owen. A. Lydia Amos. Yes. Tribal Secretary.
Yes.
Mr. Vice Chair, motion passes.
Thank you.
Okay, we had no meeting from Lake Traverse or Cooley. We will go on to the importer-exporter tax. Buffalo Lake made that like 2 months ago, Old Agency, Veblen, and Enemy Swim. The importer-exporter tax.
I'd like to make that motion, that we, remove that, however it's worded at the end. That's not waived.
Okay, we do have a motion on the floor by HIPAA. I'll give the floor over to enemy swim.
Gypsy, is it okay for it to read that, to have Fueling discontinue receiving the tax 20, 50, and 100% DMC fuel report and export until after an audit? And this account will be there until after the audit is complete. Is that okay for your motion?
Say that again?
Fueling will discontinue receiving the tax 20%, 50%, 100% DMC fuel import export until after an audit. This is an account, this will be put into account until after the audit is complete.
Oh.
Is that okay?
No. I think I would like to see it just, the tax coming to the tribe the way it's supposed to according to our tax code. So, yeah.
Okay, motion on the floor by
Second.
Haipa. Question by all agency. Or second by all agency. Question by Big Cooley.
Brandon Gypsy Wanna,
Yes.
Floyd Kirk Jr.,
Yes.
Dallas Owen,
Yes.
A. Lydia Amos. Yes. Louis Johnson. Dion Crawford,
Yes.
Curtis Bissonette. Tribal Secretary,
Yes.
Mr. Vice Chair, motion.
Thank you.
The next one is the premium pay. Veblen made it, and Buffalo Lake was the second one, then Lake Traverse. That all the employees from gaming and everybody.
I guess I don't understand who wasn't getting it. Huh? Everybody was. Yeah, I just don't understand what they mean because everybody was paid. Francis.
Mr. Vice Chair, I think what it is that every district has their district coordinators that weren't included in there. So that's why the districts are bringing that in to include the coordinators, and some of them are including the executives.
So to amend number 59 to include district coordinators and executives for that premium pay, right?
Yes, Lake Traverse.
Thank you, Mr. Vice Chair. We passed that motion for the district coordinators last month, and I forwarded the information to my district executives. I guess I'm not sure, and I think when I asked Sunny about the executives, because it's an hourly wage, it's determined by the hourly wages, that they weren't eligible. Thank you.
Francis.
Mr. Vice Chair, DCA's, I can speak on behalf of Lake Traverse District. Our salaries aren't based on hourly wages.
Like, all agency? Do you have something?
Okay, I found it. I'll read
What do you want me to say?
I'll read the motion that was made by Veblen and Buffalo Lake. Tribal Council took precedent over any other consideration for tribal entities by paying the current and past Tribal Council premium pay retro back to March 2020. They have also now set precedent for premium pay now. All tribal entities, district executives, and employees, and Dakota Nation Gaming Enterprise employees should be paid the same as tribal council and executives. This shall be for past and present employees who were employed as of March 2020, whether they were on leave status or hours worked.
I know on my part, I did the previous, and I have the staff looking for previous employees to get that paid. But I didn't look into district coordinators or executives. All agency.
So we were informed about a month ago now that elected officials cannot receive premium pay. And it was allowed up to a certain point, and then they came out with a new ruling, and they changed it so an elected official cannot get premium pay. it was allowed for a period of time, but now it's not allowed. So none of tribal council is getting premium pay. It's all stopped. And that came from Ross, the one that's doing the policies and stuff, that to receive our 1.5 million. Well, Steve Gunn too. That's where it originally came from, but Ross reiterated it.
All agency, DCA.
Thank you. DCA met with Steve Gunn and Ross. And not everybody was there from each district. But at that meeting, they explained how you guys got it, which was legal at the time. And it's still legal all the way up to April 1st is what Steve Gunn said. But that's what he said at that meeting, him and Ross. So, I mean, I'm just saying what they told us. So, right, Janelle, you were there. I don't know who else was, I think Lynn was. Lynn heard it. So.
Lake Traverse.
Thank you, Mr. Vice Chair. So that is true that it was through April 1st of 2022, but when we were informed, it was stopped. The executives drafted a memo, the chairman drafted a memo and stopped it, I think January, like the second week of January? 11, yeah.
So are you wondering about you guys getting that in that time period, or what? Is that what it is?
The back page.
Francis?
Mr. Vice Chair, I'm more worried about my district coordinator.
Well, that's fine, but that's what we're talking about, right?
No, because you're saying you guys, so you're insinuating us as district executives.
Well, no, I got down premium pay for district coordinators and executives. Because that's what the motion was made, right? That you made, Lake Traverse? Didn't you make that motion? Just for district coordinators?
And if it's not allowable, then, it's a moot issue as long as we can provide that to our district coordinators.
That's what I'm talking about. Huh? No. Let me check in on it. I know the coordinators will be good, but then I'll check to see if the time frame is good for the executive part of it. But I'll have to get with Steve Gunn. Any question? Crystal?
So I just wanted to speak on behalf of, about this premium pay. So the tribe set aside $23 million for premium pay, is that correct? With the ARPA money? So when that first happened, our councilman stated that our casino DNGE employees would be included in that $20. I don't know what happened negotiations at the table, but somehow our employees did not get a premium pay from the ARPA money, but they got a $2 raise from the profits that the casinos have made during the pandemic. I guess it was an unprecedented amount that our casinos money that they brought in. I heard it reported upwards of like $40 million. So, there's a lot of things that are going on with the ARPA money that people are concerned about. And I'm just here because there's people out there that are casino employees, number one, our frontline employees that, when the pandemic began, they got to we closed down the casinos and our employees got to stay home for, I don't know, 2 or 3 weeks, maybe it was a month. But during that time, they collected $1,000 in unemployment. Well, when our casino opened back up, they went back to work, but they weren't getting $1,000 a week like they were with the unemployment benefit. And so I just want to speak on behalf of our casino DNGE employees, our frontline workers that are out there, that, you know, they're out there keeping our casinos going. Our money continues to come in, even though we're in a pandemic. Money is still being taken in. And I would just like to see our casino employees, DNGE employees, compensated to a degree more than $2. I know some people are going to say, no, they didn't. They got $4. They got $2 in the beginning. Now they got $2 now, so they got $4. Well, some of our employees here at the tribe are getting $5. Some are getting $7. Some are getting $10. And then all of the council and former council got in excess of $10,000 payment each. And so all I'm saying is I speak for the people to be fair, that this money that came in, that $23 million, where is the reports that say all that $23 million is going to tribal employees? Is it really going to be that much by 2023 to have spent, when even now some are, you know, like some are not electing, or some don't get it unless they clock in? I think from our district, we are just asking for accountability for that premium pay. We're asking why each executive handles that premium pay for its employees differently, when it should all be across the board, because we are all in this together. And that's basically, I just wanted to ask these questions. If there's no answers, but I just want our leadership to think about that. And it's not, DCA, we're not coming here trying to ask us for money, but we want you to look at it, that what's good for the goose is good for the gander, however they say it. And, you know, and you took your payments, you got thousands of dollars in back pay. There's other people that work just as hard. I was there at the beginning of the pandemic doing a mask program, and then I got laid off because of the pandemic. As a community planner, there was no work to be going out working with community because we were all shut down. So there was nothing. So I got laid off. I didn't get any back pay from the work that I did put in. But that, you know, I'm not the only one in that situation. And so I thank you, Eddie, for thinking of people in that situation, like going back over the records and finding all of these people. But I just hope that all the programs under the executives would treat people in that same manner. And why I'm saying this, if there's something I don't know, then, you know, I apologize for that. But I'm just saying what the things that came up to me from people in my district and from our meeting, and then people that work at the casino. I'm just mainly speaking for them. Thank you.
Thank you, Crystal. I just wanted to, when I said I was going back, that wasn't just for my employees. That was the tribe as a whole that I was talking about. It's still in the works though. So, Haipa.
I guess I was gonna see how this would work if we made a motion to amend the February 2nd minutes, motion number 59, to include the district executives and other employees to receive that premium pay if it's allowed during that same time frame. I don't know, some of the other like our district has different employees working on working there as well, aside from the district coordinator.
Enemy Swim?
Sorry. Going back to like what Crystal was saying, and you know, initially, yeah, we were thinking about the casino employees at DNGE, and then this worked out more conveniently of doing the $2 raise and then the $2 premium hazard, whatever you want to call it, for the frontline workers. And you know, the intention at the time when we did that was $4 for the frontline worker. Because the way I say it, I know this, some will see this in a different light, but at the time, the casino workers would get $4 an hour as a frontline worker. The lowest paid individual getting premium pay at the tribe would get $3 an hour. I thought at the time doing that with sport council was that, you know, they'd be getting the most than the lowest one at the tribe for once. And then, like at the district, because I know the district didn't take any action on this because they want to know how much money we're talking about and they want to see numbers, and that will be coming, you know, to the next meeting because I have the MRs that Eddie gave in his report last month. But now, though, some other things have changed that if we were to give ARPA funds to DNGE, they would have to follow said guidelines explicitly. And one of those is if you are not vaccinated, you do not receive your premium pay. And during a couple of our meetings with DNGE, we have a large amount of workers at DNGE that are not vaccinated. And then out of those, they said that if there was to be something like that, they'd just simply walk off. And so then it kind of became a, you know, one of those business decisions. We can go forward and put the money there, but then if we have 40% of the workforce walk off and we're already shorthanded, then what? And that's kind of the question that was rolling around, and I know that the DARE team is trying to get vaccination processes set up at the Dakota Magic with the help of the North Dakota governor, as he has indicated in previous times. So he's willing to give us those tests and vaccinations to go forward with that. But those were also the same questions that came out during the district meeting. And so I'm all about supporting our DNGE folks, and that's why council took action the way it did. But then that's the potential downside. If we give them these ARPA funds, how many of these individuals are going to walk away from the workforce, creating problems that people are already overworked as it is at the casinos. If more people were to walk off, that's not going to make it any better also. So it's kind of one of those compare and contrast things, and I just wanted to share that, Chris. Thank you, though, for bringing it up. I appreciate it.
Well, just one more thing with that is we don't know until we actually find out. I mean, numbers are, 40% say they're going to walk off. Well, how many did you really survey to get that amount? You know what I mean? I'm just saying, why would somebody walk out if they're getting $10 more an hour? You know, to me, it just doesn't make sense. But I'm just saying.
At that time, Crystal, when they were getting unemployment, it was more than what we were actually giving them with premium pay at that time. That's why there was some that left and didn't want to come back. Old agency?
Thank you, Vice Chairman. I have a two-part question. One, were the for-profit businesses included in hazard pay? And then the second thing, to Councilman from Emily Swim, were non-tribal members given hazard pay?
At DNGE or at the for-profit?
Anywhere.
I believe so, yes. So at DNGE, it's being paid out of their coffers, but for-profits, I'm not exactly sure if how that's working out, I'll be honest on that one.
So as non-tribal members, is that even allowed? I think that might be a Steve Gunn question, but I don't know. Seemed like the ARP money was designated for our tribe, not people attached to our tribe. I'd like to have that researched, because I don't think we're responsible for non-tribal members. They should be just happy that we employ them. I still believe that. But that's my second question, that if you could research that, Vice Chairman, with corporate, because I know fair labor law and all that kind of stuff, but in this world, what ours is ours should stay ours, because they definitely don't share with us, the non-tribal members. They're takers.
I'll look at that. I'll look into it, but just from going back to the CARES and ARPA, I don't remember reading any guidelines saying that it had to be specifically with tribal members, because I know CARES was a little more on that, and it was tribal, but ARPA opened it up to where it's helping our businesses that lost revenue and stuff like that. So I'll look into it though, Jesse. Is there anything else?
We'd like to request to go into executive session.
Okay. Council. Motion made by Enemy Swim. Second by Long Hollow. Question by Big Cooley.
Yes. Yes.
Thank you. by HIPAA, question by enemy swim to come out of exec.
Three to five? Or 3, 4, 5?
3 to 5 inches. Ready?
Yes.
Yes.
Thank you, Lindsay. Dicky?
Okay, DCA motion number 03-03, motion made by Francis that tribal council give DCA a written response on why the district cannot create their own section 17.
Francis?
Mr. Vice Chair, and the reason why I made that motion is, old agency is going through some issues with their businesses that they're trying to create, and they're trying to adapt Section 17. And they said that, their executive explained to us last night that council saying that, Greg Paulson saying that they can't do this. Well, each district has its own constitution and bylaws, and they govern their own affairs. So that's why I don't understand why we can't, why each district can't create their own Section 17. But the other part of the coin too is that why would we need a Section 17 when Buffalo Lake didn't do it for their bowling alley? Agency C-Store didn't do it or Agency Village didn't do it for their C-Store. Enemy Swim didn't do it for their ventures. So I don't know why they would be required to even have a Section 17 unless they wanted to be totally autonomous from their district councils. So I don't feel that there should be a reason why each district, if they wanted to, could create their own Section 17. Because like I said, in our constitutions, council is not supposed to interfere with district business. And this is district business. Thank you, Mr. Vice Chair.
Okay, I will get with Paulson on that to see if you even need a Section 17 and why you ain't able to do it. Old agency.
Yeah, I believe we already had a motion pending legal review, and we've never gotten that. I believe it got to Megan, but we never got a judgment from Megan or a decision. I gave the letter last month to the chairman requesting a roundtable with the execs, even with council if need be, with Travis and his lawyer Icky and our lawyer Nielsen, so we can sit down and figure out the one paragraph that Paulson's having trouble with. So if you can set that up, I'd appreciate it, Eddie, Vice Chairman, because I haven't gotten no response from the chairman's office on that. I think Floyd has tried also to get this set up, and we lost 4 months from when we submitted this, if not more. We were hoping to have it up in Aberdeen, and the director was waiting for us. I visited with him when he was here, and he gladly take it, as long as it's ratified by this council. I'll put it on it.
Thank you. Any other questions, council or DCA? No? It's not, floor is open for motion to approve DCA report.
Second.
Motion by Long Hollow, second by Lake Travers. Question by Big Cooley.
Curtis Bissonette,
Yes.
Brandon Gypsy Wana, Boyd Kirk Jr.,
Yes.
Dallas Owen,
Yes.
A. Lydia Amos, Louis Johnson, Dion Crawford,
Yes.
Tribal Secretary,
Yes.
Mr. Vice Chair, motion passed.
Thank you, DCA. No, I'm just kidding. Francis.
Mr. Vice Chair, it doesn't have nothing to do with DCA. It's just that, you know, I was getting texts and whatnot before DCA came in front of council. Apparently, Madam Secretary, you might have had a program manager come in here and was trying to deflect some issues that happened on our reservations, a tragic incident that happened at one of our housing complexes, saying that, you know, this followed back on the housing. Well, that should never been allowed to, you know, be said, Mr. Vice Chair.
Actually, it wasn't about the housing, it was actually something to do as a tribe as a whole.
Okay, because and I know that, you know, this incident's still being investigated, you know, so I mean, I don't, you know, I feel kind of bad talking about it right now because the family's in mourning.
Right.
You know, I've been down that road, you know, so I know that feeling.
Yeah, housing was discussed, but it's more of a blanket type thing that we're trying to do.
And if you guys want to sit down and visit, I mean, I'm more than welcome to come out and visit with as well. Thank you, Mr. Vice Chair.
Yeah. Long Hollow.
So, Mr. Vice Chairman, is there a meeting with him like tomorrow or something? 10 tomorrow? Yeah, and I thought it would be a good idea if we all met with him too. So, I don't care. Oh, we got council tomorrow. Yeah. Well, afternoon. I'll put it on the chairman's tab out here. Yeah.
Motion to adjourn? Motion to adjourn?